Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What causes frequent urination? Frequent urination is often caused by drinking lots of liquids, especially caffeine or alcohol. However, if your frequent urination isn't related to fluid intake, it may be due to an underlying medical condition. /r/n/r/n The most likely reasons for frequent voiding are urinary tract infections, UTI, and medication side effects. A persistent urge to urinate, though, could indicate a chronic condition like diabetes or interstitial cystitis. /r/n/r/n This article discusses frequent urination. It explains common reasons why you may feel the urge to pee more often and when to see your healthcare provider about a persistent urge to urinate. /r/n/r/n The obvious symptom of frequent urination is just thatneeding to urinate more often than usual. It might happen during the day or more at night, a condition called nocturia. /r/n/r/n Symptoms can include the following. /r/n/r/n Urinary frequency may occur on its own or with other symptoms, such as fever, pain, or increased thirst. Be sure to let your healthcare provider know if you're experiencing any other symptoms along with urinary frequency. /r/n/r/n Your healthcare provider will review your symptoms when determining the likely cause of your urinary frequency. Some of these causes include /r/n/r/n Frequent urination on its own is not usually a problem, but if it is disrupting your sleep or ability to function or accompanied by other symptoms, talk to your healthcare provider. /r/n/r/n See your healthcare provider promptly if you experience any of the following symptoms. /r/n/r/n Frequent urination can be a symptom of many different conditions. Your healthcare provider will usually perform a physical exam and ask whether you are on any medications, have any symptoms of infection, or have had any change in your eating or drinking habits. /r/n/r/n Your healthcare provider will also likely ask for a urine sample to check for bacteria, urine culture, or white blood cells, urinalysis, that could indicate an infection. If red blood cells are confirmed, 3 or more, urine cytology will be ordered. Other possible tests include /r/n/r/n Treating the underlying condition is usually the best way to deal with frequent urination. This may mean controlling a person's diabetes, treating a urinary tract infection with antibiotics, or undergoing cancer therapy. /r/n/r/n If the condition is diagnosed as overactive bladder, treatment may include /r/n/r/n It may also include anticholinergic medications, such as Oxytrol, oxybutynin, or a beta-3 adrenergic receptoragonist medication such as Myrbetriq, mirabegron, or Gemtesa, vibegronbotox injection, or other procedures to modulate the sacral nerves or other nerves. /r/n/r/n Bladder training entails keeping to a strict urination schedule and increasing the time between when you empty your bladder. The aim is to increase the amount of time between urinating and how much liquid your bladder can hold. Your healthcare provider may also prescribe a medicine that calms the muscles and nerves. /r/n/r/n Interstitial cystitis doesn't have a cure, but some treatments may ease your symptoms. These can include /r/n/r/n There are some causes of nighttime urination that can be controlled. The best thing you can do is to reduce how much you drink at night. This is especially true in the 4 to 6 hours before bedtime. /r/n/r/n Frequent urination can be annoying and embarrassing. But more than that, it may be a sign of infection or disease. /r/n/r/n Call your healthcare provider if you're urinating more than usual. They'll talk with you about any recent changes to your fluid intake, do an exam, and potentially order some tests to find out the underlying cause of your frequent urination. /r/n/r/n Some treatments can help, but the treatment will depend on the underlying cause of the urinary frequency. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.